Over the past month, we've heard a lot about young children becoming very sick and even being hospitalized in some cases with RSV. As we enter in flu season and another potential wave of COVID, health professionals are concerned. So how are these trends playing out locally? We'll talk with local experts. That's next on WNIN Newsmakers. Hospitals in some areas of the country are becoming overwhelmed with cases of RSV, especially in small children. Well, here to talk about if there's anything to worry about in our area is Dr. Gwen Shelton, a pediatrician from Ascension St. Vincent. Thank you so much for being here.
Thank you. It's a pleasure.
Well, tell us first, help us understand exactly what is RSV, and are there certain people who are more likely to get it?
So RSV is a virus, and everybody gets it. Almost every child by the time they're 2 or 3 years old has had a case of RSV.
All right. So, and we were even talking earlier about, in our own experience, whether our kids have had RSV. Is it a possibility that you can confuse the symptoms of RSV with a common cold or things like that?
For most children, RSV is a common cold. It affects the nasal passages and the back of the throat, and you'll get a lot of mucus. It tends to cause a lot of mucus because of the way that the virus penetrates the back of your nose and throat and kills off those cells and takes over those cells, replicating more virus. So it's kind of a good pirate virus. Gives you a lot of nasal mucus.
Okay. So whenever we think about how contagious the common cold is there any additional concern in how contagious RSV is?
RSV is a very contagious virus. It passes mostly through contact, so if you contact the mucus or secretions of a child that has RSV, you are likely to get it, unless you do really great hand washing. It's a little bit different than we think of COVID and flu, which are more likely to transmit through droplets in the air.
When we talk about having the similarities between RSV and the common cold, how is it that some of these RSV cases are becoming so severe, and why is this becoming such a concern about RSV if it's something that a lot of times we have and may not even realize it?
Right. RSV is more likely than many viruses to go from the upper respiratory tract, your nose, your throat, down into your lower respiratory tract. And in babies and toddlers up to about 2 years of age, you have about a 1 in 6 chance of that virus not just affecting the nose, but getting down into the bronchioles or the lungs, where it causes something called bronchiolitis, which you can, I think as a layperson, you can think of as pneumonia, but it's caused by a virus, not a bacteria.
Since it's not a new virus, why is such a concern this year? We've heard about so much of the concern and about the kind of explosion of it. Any thoughts about what's driving that and why this is becoming more of an issue right now?
Well, the numbers are just very, very high right now. They're about 3 times higher than they are in a usual year, and the virus has hit us much earlier in the year. Here in basically northern climates where we have 4 seasons, RSV tends to be a winter virus. In places where I've trained before, like in New Mexico and places like Florida, Texas, they can have RSV year-round, but we tend to keep it to the winter. The answer is because we were quarantined or laying low with COVID or masked. We just didn't see the transmission of either flu or RSV nearly as much over the last 2 years. Mm-hmm. And so everybody was kind of saving up. So the fact that we have 3 times as much RSV is because we really have 3 years of it all at once.
So, and of course, wintertime is also flu season. We are still dealing with some residuals from the COVID-19 pandemic. So what are we seeing in terms of hospitalizations locally? And is there any concern that flu and RSV and possibly COVID are hitting all at the same time?
Yes, we are having a lot of viruses. Our hospital at Ascension St. Vincent's is full. Now there's good turnover, so if your child needs to be hospitalized for any reason, chances are you'll be able to get a bed within the same day. But a lot of people are waiting a little longer in ERs, urgent cares, doctor's offices than we would typically be waiting. Because those, again, they're running about 80 to 90% capacity. I understand that's true all over the Midwest. In fact, we have a couple of kids that have had to travel recently from other major metropolitan areas to end up in Evansville because we have had those beds available. So relative to some places, I guess we're in good shape.
Is there a chance that a child could potentially come down with both RSV and flu or some type of co-diagnosis at the same time? And what type of risk would that present to the child?
That's a good question. Certainly what we usually see is children that get back-to-back-to-back viruses. They'll have a cold, and then they'll get better for 2 days, go to daycare, and then come down sick the very next day. So it's much more common, and I think this has to do with how your immune system works. Much more common to get back-to-back-to-back viruses. So it may seem like your child's been sick for 3 months. Now, if we do swabs, and we don't usually do tests or nasal swabs for all of these viruses, at least in an outpatient setting, but if we did swabs, we would probably often find that they are shedding more than one virus at a time. It doesn't, and perhaps some experts could speak to this better than I could, but I don't think it predicts a more terrible course or worse outcome.
Okay. So as a parent, and I know some parents who are worriers, how do you start to distinguish? We know some of the simple symptoms of colds and RSV. So how do you distinguish colds from RSV? And how do you start to determine this is becoming more serious? I need to check with my pediatrician.
Great question, and it depends a little bit on the age of the child. I'm going to assume that you've got a healthy child who's not a newborn, not a baby who was in the NICU or preterm. So if you've got a baby that doesn't seem to have other risk factors, maybe is a year old and they're growing and otherwise healthy, if they have a low-grade fever, maybe 100, 101, they have a runny nose, they maybe have a cough that sounds yucky, but they're basically playful, you give them some Tylenol and they can sleep, they're drinking, they may not have as good an appetite, but they'll take a few bites, and they seem to be breathing comfortably, then you're in good shape. They have a cold.
When you look at potentially seeing that it's RSV or starting to see maybe this child not getting better, or maybe their symptoms are becoming more severe, how do you start to recognize that? Whereas you're kind of balancing not running to the emergency room all the time or the urgent care, but then again, you are attending to your child as need be.
If you have a child who's struggling to breathe in any way, those breaths are loud or sound squeaky or look like it's difficult to breathe. If you see labored breathing, the chest may be heaving up and down, or you see what's called retractions, which is pulling in either up at the neck or under the ribs. Anytime you have that increased work of breathing or labored breathing, that's really concerning. You need to get that child checked right away. They need to check the oxygen levels. They need to listen to the lungs and see if there's any reason to worry about the baby not being able to get enough oxygen.
Okay. Well, let's talk preventative. I know lots of parents at wintertime, or even pregnant ladies who are getting ready to give birth, or lots of hand washing, lots of hand sanitization, those types of things. So is there anything that we can do to make it less likely that our children are going to get sick this winter?
We can do some things to prevent. We all should do good hand washing. If your child is sick, they should be at home. But in the end, sooner or later, everybody's going to get RSV, and everybody's going to get the flu, and I think that's what we've proven to ourselves by not having very much of it the last couple of years, is that it will catch up with us.
All right.
So you can do the best you can. I also want to point out having just an environment that's friendly to the nasal passages and the mucous membranes is really important. So I know smoking in the house environment. I'm not here to judge smokers, but I really want to emphasize that there should be no smoke of any sort in the house, because little kids' nasal passages get irritated, and then the viruses have a field day.
Are there other simple things that we can do? The air's pretty dry in our homes and around us in the wintertime. Should we be using humidifiers and things like that that help?
Great, I'm glad you brought that up. Definitely cool, moist air is easiest for us to breathe. So keeping the temperatures in the house under about 72 to 75, so down at 68 to 70 would be great for sleeping especially. Running a humidifier, I like a cool mist humidifier, it's a little bit safer, but if you've got a hot mist humidifier and make sure that nobody touches that, then you're in good shape.
Okay. Well, we talk a lot about vaccines because we have the COVID-19 vaccines. Is there a vaccine for RSV or something else that parents can do, especially if they're in that high-risk category?
So for very high-risk babies, which would be babies who are born extremely preterm, very small, very early, or babies that have certain conditions like heart disease, there is a preventive shot. I don't know if everybody's familiar with monoclonals. That was a treatment that was used for COVID. This is another type of monoclonal that specifically targets RSV virus. And little at-risk babies receive that as a shot once a month for about 6 months during the height of RSV season when they're very young.
Is this something that generally a pediatrician, such as yourself, or the family doctor might suggest for the high-risk baby, or is this something that maybe parents should approach their physician with?
So almost all high-risk babies would have a recommendation or even a prescription for that when they leave the NICU, the neonatal intensive unit. So most folks know it's not just for a baby who was born a couple weeks early. These would be very early babies, like 28 weeks, 26 weeks, or having some significant underlying condition. So it wouldn't be mysterious. It's always fine to ask us. Ask your doctor if you're curious whether you or somebody that you know would qualify, and we can look into it. But most of the time you come out of your NICU setting or your intensive care setting knowing this.
Well, we've talked a lot about kids and young babies, but you also mentioned that other people, everybody pretty much gets RSV. So is it a risk to adults or even our older generation? What should we be looking for in terms of RSV if we think we might have it?
Sure. So the immunity to RSV does fade over time, which is another reason why the vaccines don't work very well for it. So while you likely won't get bronchiolitis or anything affecting your lungs as an adult, you will get a bad cold from RSV. And now if you have an underlying condition like asthma, or if you're an elderly or frail person, then RSV can be a risk to your health. And if you anytime feel like you're struggling to breathe or having chest pain, or obviously go see your doctor right away.
All right, Dr. Shelton, thank you again so much for your time and expertise.
Sure, thank you.
After the COVID-19 pandemic, what has the medical community and the public learned about the value of public health issues? To talk about that, we have Julie St. Clair, MSN RN, Clinical Assistant Professor of Nursing from the University of Southern Indiana. Thank you so much for being here.
Thank you for having me.
So can you give us, just for our kind of level setting, can you give us a brief description of public health, what it is, kind of what all it encompasses?
Well, public health is making sure that populations, instead of just focusing on just individual patients, that we have measures in place that protect large numbers of people. So that can include things like making sure we have safe water to drink, making sure that the air quality is good for our lungs and for our bodies, and then doing things at a large level, such as immunizations to prevent vaccine-preventable diseases.
And is it also the establishment of certain policies and
Yes.
procedures and things like that? What all goes into that type of thing? Because it affects all of us, and there sometimes are dissenting opinions on
Yes.
how we best protect ourselves.
Interventions at the policy, system, and environment level. They're a little bit different than those clinical interventions. And so, when you set policies for things like smoke-free communities, for example, or workplace no smoking policies, you're really implementing system-level changes that provide the greatest amount of good for the greatest amount of people. So you're always going to have people outside of that greatest number of people that are not going to agree with your policies, but the same thing for having vaccine policies for children entering school or entering daycare. It provides a level of safety for all the rest of the kids. When you've got at least the majority of kids vaccinated, there are some people that aren't in agreement with vaccine policies either, but it is something that historically we know has made a huge difference in a lot of infectious diseases that even people my age in clinical practice have not ever seen, because you don't see them very frequently.
How do COVID-19, the COVID-19 and the RSV or flu highlight the importance of these types of public health issues, especially whenever we get into things like the pandemic or a very severe flu season or RSV like we're seeing now?
Well, of course, COVID's new. It was a novel virus that appeared in 2019, so we don't have as much history with that. But RSV, that has been around for a long time, and influenza, of course, has been around for a really long time. And in terms of policy measures and how to handle those infectious diseases, we have seen that some of the measures that we've taken, for example, in the past 2+ years with COVID, have made a difference in transmission of things like influenza and RSV, because if you look at the data, we had very low transmission levels of flu in 2020 and 2021, and now we're starting to see an uptick. Same thing with RSV, our levels were much lower, and now we're seeing an uptick in those RSV infections, and I think that's really a testament to how effective the measures such as hand washing and distancing and wearing masks have been in keeping large numbers of people healthier during those seasons.
Right. And having done that, are we kind of seeing this rebound because we have been doing those types of things? And would you not suggest always continuing to mask, but keeping some of these things that we know are working in place for the future so that it can kind of tamp down some transmission of some of these other diseases?
Sure, I think absolutely that one of the things that has occurred with younger kids is they really have naive immune systems. And in those last 2 years, you've have not had exposure to the level that we're seeing now to those infectious agents. So they have not developed any antibodies. And so now you're seeing, boom, they're getting sick because they're being exposed. As far as, what do we need to continue doing? One of the things that I really want to point out is we are still in a pandemic. Talked to my students about this just last week. Until the World Health Organization tells us we are no longer at pandemic level, we are in a pandemic. And we are expected to see some uptick in our cases this fall, although unless we have a brand new variant, I just read something yesterday about they expect this to be more of a wave. It's not going to be boom like it was last fall. So we need to continue to be cautious. I know people are really tired of COVID and tired of the measures that we have to take, but I think it's worth being careful. And one of the things that people can do is you can go to the website that the CDC provides, or you can just Google in CDC or community levels of COVID, and you can actually put in a drop-down menu your state and your county, and it will pop up and show you what level of transmission is your county right now. Okay. So for example, Vanderbilt County is yellow. We were in the green, which means, green is good. Yellow, people that are at higher risk for infection really need to be taking more precautions right now. But if we pop back up into the red, everybody needs to be masking in public places again. Okay. I'm sure people in general won't. I don't think we're going to see everybody in a mask, but I've actually seen quite a few people in masks out in Targets and Walmarts and grocery stores, so some people are already following those precautions. But we all still need to think about what can we do. Vaccination is really one of the top measures. We have really excellent vaccinations for both flu and for COVID. The bivalent booster is out.
The new booster.
We should be getting that. Okay. Everybody who's had a primary series, which would be kids from 5 years of age and older, if they've finished the primary series, which is usually 2 shots, then they're eligible for that booster if it's been 2 months. And then if you've had a recent infection of COVID. For example, I tested positive for the first time on August the 1st, so I had to wait 90 days. They recommend 90 days until you get your bivalent booster. So I just got mine last week. But other things to think about, especially with holidays coming up and family and group gatherings, again, things that we always tell people, we've told them before COVID, hand washing. You can also do some social distancing, particularly if you've got maybe a more at-risk person, kind of keep them a little bit distance. You can open windows and run fans to improve circulation in the room. And then if you have somebody who's really at risk, you need to think about, is it in their best interest for everybody to have a mask on?
Okay. Well, and you mentioned we all need to be reminded that the WHO says that we're still in this pandemic.
Yes.
At what point does that change?
I can't say that I know all of the criteria, but the only other pandemic that I've really been personally involved with is the H1N1. And you know, they had declared a pandemic in June of 2009, and then it was August of 2010 that they decided that, you know, the transmission level had dropped, the number of cases had dropped. So there are some metrics in place that they'll look at that. And really, pandemic by definition is, you know, global. So they would look at that at the global level to determine whether or not we have a pandemic anymore, or can we close that book.
So are there more things for us to learn, especially from COVID-19, because it taught us so many things about both what to do and possibly what not to do. And you mentioned some of the things we have learned. We've noticed about masking and those types of measures are effective in terms of transmission rates. But are there other things that we've learned from something like this? And do you kind of see things on the horizon that we can do better about?
Probably one of the most disturbing things that I have seen is misinformation and disinformation about what these diseases are and what the causes are and the politics behind all of that. And we really need to make sure that people, if they want to dig for information on their own, to go to credible sites like CDC, World Health Organization, Harvard Medical News. You know, there's plenty of really good credible resources available, and not go to TikTok and Facebook pages that aren't really credible sources of information, because I think that really spreads a lot of mistrust in the recommendations that are really in existence to protect the public.
Well, we've mentioned with Dr. Shelton, we've talking about RSV, we're talking about the flu, we're talking about COVID-19. Is it unusual that we have so many viruses that are causing high concern circulating at one time, or has it really always been like this? We're just shining more of a light on it.
I would think that because we're still in a pandemic, that people's awareness is heightened, and we do have increasing levels of the more usual viral infections, the flu and the RSV, that we have more awareness. And you know, flu and RSV are always going to be circulating. They're always at a certain level in the community, and we really anticipate that's going to be the same thing with COVID. It's new, so you know, we haven't dealt with it before, but most likely it will fall into that category, and it'll lower in terms of the level of transmission and the number of cases that we're seeing, but it'll probably continue in circulation.
So beyond just becoming better educated patients and society members, is there anything that we can be doing as a society to either prevent or help along policies and procedures and public health whenever it comes to things that happen nationally and internationally?
Well, I think people have lost a lot of trust in some of the public health system messages, and so I hope we can regain trust, and people do go back to those reliable sources and follow the recommendations. I think it used to be that if your doctor said this is what you need to do, or your nurse said this is what you need to do, that people really trusted that information. So I hope we go back to a better level of trust and really take to heart that we need to follow the recommendations. And the other thing I always try to explain to people is that we're really not always doing these measures just for us. You know, we are a country that values independence, but we are also a country that cares about each other. And so that's really what you're doing when you get vaccinated and you try to prevent these infections. You're not just doing it for you, you're doing it for those people that are around you that you care about, and really thinking beyond yourself.
Well, and we're really part of a global society and
Yes.
global community now, a global economy, and we're very mobile. So what happens in America can be, and vice versa, right, in other countries, can be transmitted and brought here or brought to
Exactly.
other countries and affect other societies as well.
Right, and we've seen that recently with monkeypox, and we saw that several years ago with Ebola. I mean, you're just a plane ride away from some new disease coming to America. So, you know, we always have to have good surveillance in place. I think one of the lessons that's been learned from the pandemic is we need to really value the public health system, and we need to support that infrastructure. We have not had good funding for our public health facilities, and we really need to do a better investment in making sure that we have well-prepared public health structure, because there will be another pandemic that comes along.
Mm-hmm. And even as difficult as it was pretty amazing to see the states and and the Public Health Society or public health providers come together and do mass vaccination clinics, and really everybody did come together as a major team to address this, didn't they?
Yes, and you know, of course, my background is public health, and that's, you know, the emergency room nurse gets excited about trauma that comes through, and not that she wants people to get hurt, but that's what you're trained to do. And my training is in public health, so I certainly didn't want this to happen, but it was nice to be useful and to put some of what my background has prepared me for into some of the measures that we took. Like, you know, we did a pretty big vaccination clinic at the arena on campus in 2020, and that was a great thing to do and be part of. It's historic.
All right. Well, thank you, Julie. We appreciate all your time and expertise. Thanks
Thank
for
you.
being here. Thanks again to Dr. Gwen Shelton from Ascension St. Vincent and Julie St. Clair from USI for joining us to talk about RSV. We'll see you next week. Thanks for watching WNIN Newsmakers.